Greetings, everyone. I am Cadet Ashwarya Chabra, and I am here to introduce you to the infectious and contagious diseases and their preventions. The outline of the chapter will be Part 1, Classification of Diseases, Part 2, Preventive Measures. Many of the deadly diseases can be prevented from spreading to healthy persons if proper precautions are taken up by checking infection and contagion of several diseases and by killing carriers of several other diseases. Classification of diseases. Number 1 will be excremental diseases. These are those diseases which are communicated or transferred through human excreta, that is urine and feces. The excreta can contaminate food, water, or hands of cooks and thus pass on the infection. Typhus fever, dysentery, diarrhea, jaundice, and intestinal worms are some of the important diseases belonging to this group. So the first type of diseases can be excremental diseases. We need to remember, and they are those diseases which spread through human excreta. Am I clear? Next, second is droplet infection. These are those diseases which are communicated or transferred through germs which are sprayed out from the nose, throat, or lungs in the air in small droplets of saliva during coughing, sneezing, or even while talking. These germs are inhaled by a healthy man if he happens to be near the sick. Common cold, influenza, diphtheria, meningitis, inflammation of the brain, and tuberculosis are the common diseases in this group. So droplet infection. We know this because COVID-19 also could spread from droplets, which are, coming out from our throat or nose, anywhere, right? Next, contact diseases. These are those diseases which are communicated or transferred when the germs pass from a sick person to a healthy person by actual body contact. Venereal diseases, that is syphilis, gonorrhea, and skin infection are some common examples. Okay. Next, insect-borne diseases. These are those diseases which are communicated or transferred when the germs move from a sick person to a healthy person through blood-sucking insects known as carriers. These insects first bite a sick person and then bite a healthy person, transferring the germs of the diseases in the blood of the healthy person. These germs then multiply in the blood of the healthy person during the period of incubation, and at the end of which he starts showing symptoms of the disease carried by the insect. Some of the carrier insects and their diseases are mosquito, malaria, dengue, and filaria, sandfly fever, kala azar, oriental sore, then lice, typhus, relapsing fever, flies, diarrhea, dysentery, cholera, typhoid, fleas, plague, typhus, and ticks, relapsing fever, and typhus, right? So these are some examples how the diseases are spread through various, insects, which are known as carriers. Malaria, dengue, all these diarrhea, cholera, typhoid, all of these are very common diseases which are spread through insects, right? Next is waterborne diseases. Certain diseases spread due to infection carried through water. These are cholera, dysentery, diarrhea, jaundice, etc. These spread as water gets contaminated through vomits or feces passing into it. Epidemics are likely to spread if immediate steps are not taken to disinfect water and to properly dispose of the excreta through efficient conservancy arrangements. All sources of the diseases ought to be eliminated. So waterborne diseases, the prevention is obviously fresh and clean drinking water, disinfected drinking water, right? Otherwise, due to dirty water, these infections can take place, right? And these diseases can occur like cholera, dysentery, diarrhea, jaundice, etc., right? Next, the sixth type of disease is animal-borne diseases. The germs are transmitted through the agency of animals by drinking milk or through the agency of insects. Rabies, plague, anthrax, and tuberculosis are some of the common examples, right? Next, now let's talk about the preventive measures. Till now, we know what kind of diseases are there and how are they spread, and what are their examples. We all know about that. Now we need to see what are the preventive measures. How can we prevent those diseases? Because obviously prevention is better than cure, as we all know, right? Now, prevention of excremental and waterborne disease. Number one, control of water route is easy by disinfecting water or providing safe water in place. Second, control of the milk route is easy by subjecting the milk to boiling or pasteurization. Third, foodborne infection may be controlled by standards of food hygiene, exclusion of sick persons from food handlings, strict attention to personal hygiene, promotion of hand washing, protection of foods against flies and rodents, and providing facilities for refrigeration. Safe disposal of excreta will block the transmission of diseases by the fecal oral route. Prevention of droplet infection. This can be achieved by use of mask, bed spacing, screening, dust control, avoid overcrowding, proper ventilation, avoid spitting in public places, and proper sunlight. I don't think I need to explain all of these. These are very obvious now. We all know how to prevent these diseases, right? So use of mask, avoid overcrowding areas, proper ventilation, screening, dust control, bed spacing, proper sunlight, all of these are important preventive measures. Clear? Now, prevention of contact diseases. Number one, complete segregation of patient. Second, no direct personal contact between patient and the staff. Third, the early diagnosis will help in preventing the spread in the patient. Fourth, proper disposal of all the excreta and disinfection of all articles of the patient. Right? I don't think I need to explain this. This is very self-explanatory, all of these points. So yes, these are the preventive measures for contact diseases. Next, prevention of insect-borne diseases. Filling, leveling, and drainage of breeding places. Oh, I'm so sorry, 1 second. Breeding places and water management will help in eliminating larvae. Adequate collection, removal, and disposal of sewage and wastewater are important in preventing pellets. Second, use kerosene oil, fuel oil, or special oil to prevent larvae. Third, use of residual sprays like malathion. Fourth, use of mosquito nets, screening of doors and windows, mosquito repellent, and sundown sleeves. Fifth, control the presence of rodents and fleas in and around the home. Sixth, avoid contact with any species of wild rodents, especially sick or dead rodents. Next, preventive measures to ward off these diseases. Number one, segregation of the patient. Preferably shift patient to an isolated room. Ensure room conforms to hygiene and sanitation standards, that is adequate ventilation, sunlight, and cleanliness. Third, nominate one healthy person to undertake nursing and care of the patient. Fourth, nominated person to take preventive measures like use of mask, gown, and gloves, and avoid direct contact and hand washing before and after every visit. Clothing and utensils used by patient to be cleaned, washed separately. Safe disposal of patients' excreta, urine, stool, sputum, refuse. Next, preventive measures to ward off these diseases. Number 2 is continuing that. Second, destroy agents causing infection in the surrounding area or premises immediately on detection of a communicable disease. The source of agents or germs causing infection should be destroyed by following actions. First is removal or destruction of garbage, cleaning the drains and keep them covered, remove dry out wastewater, spray malathion mixed in water. Ratio should be malathion 1 ml and water 1000 ml in and around premises. Caution, malathion is highly poisonous. Direct breathing, touch should be avoided. So please see to that. Then wash hands after use. Obviously, this is very important. Then keep premises free of rodents, rats, stray dogs, right? 6 is use mosquito nets, long sleeves, screening of doors and windows. Clear? Continuing the same thing, the third thing is disinfection. All articles in contact with the patient should be disinfected by following means. Number 1 is natural. Sunlight and air can be used to disinfect articles like blanket, mattresses, pillows, and also the rooms. The microorganisms thrive in darkness and need moisture for their survival. On being exposed to sunlight and air, they die. Second is physical. Physical agents like heat, cold, radiation, etc. can also be used for disinfection and sterilization. Then is heat. Heat can be used in 2 ways for sterilizing. Number 1 is moist heat. Moist heat in the form of boiling kills germs very rapidly. In addition, autoclaving or steam under pressure is the most effective method used to disinfect all hospital equipment, which can be boiled like linen, bandage, dressing material, gloves, and instruments. Second is dry heat. Dry heat like flaming or use of hot air oven. Sterilization by steam under pressure autoclaving, which is the commonest method for sterilization, which is being used in the army as well, right? So this is another means of disinfection. Then is cold. Freezing or freeze drying can inactivate bacteria. Some of them can, however, survive even at 0 degrees Celsius. Then is radiation. It includes ionizing radiations like X-rays, gamma beta, and ultraviolet radiation. These are expensive methods and are not suitable for small-scale procedures. Other methods can be disinfection, and sterilization can also be done by using other methods like infrared rays, filtration, etc. Clear? Next. Third is chemical agents. Chemical agents like phenol, Savlon, potassium permanganate, hydrogen peroxide, etc. are commonly used for disinfection and sterilization. The strength of agent depends upon its use concentration being. Fourth is control of food and drink. Salient points to be observed by feeding the patient while feeding the patient will be clean water, preferably boiled, must be served to the patient. Water container must be kept covered. Balanced diet, well-cooked, hygienically prepared food using less oil and condiments should be served hot. Stale, cold, and food exposed to flies and insects should not be served at all. The food items sourced from restaurants, dhabas must not be served, right? The fifth one is inoculation and vaccinations. Important inoculations and vaccinations are provided free of cost under various government programs. These are administered at primary health centers or hospitals. it's not available, the same if not available, the same should be administered, taken from the market. Important inoculations and vaccinations are as under. Name of vaccine is Rabipur vaccine, which is to prevent rabies. Then TAB vaccine is for typhoid, hepatitis B for hepatitis B, TT for tetanus, oral polio for polio, right? So these are some examples of vaccinations, right? Now, concluding this chapter, communicable disease, as the name suggests, are most easy to prevent if timely measures are taken as recommended above. As these diseases are communicated through some carrier or agent, their spread on occurrence is difficult to control. It is advisable to always follow the prevention measures to save precious human and animal lives, natural resources, and effort. So on that note, always remember, as I always said, prevention is better than cure. And thank you so much for listening. This was Cadet Ishwara Chabra, now signing off. Thank you.